Dr. Anthony Fauci is sharing lessons he's learned from a decades-long career in public health. I sat down with Dr. Fauci for my podcast, The Takeout, to discuss his new best-selling book, On Call, as well as President Biden's debate performance. You write in the book, Dr. Fauci, about regular interactions with President Biden, and you talk about frequent phone calls you got from him, his level of curiosity, the depth of his understanding of the underlying issues related to COVID and everything else, his curiosity, the questions. Simple question. Did your interactions with the president in any way resemble what you saw in the debate performance last Thursday?
No, I mean, obviously not. You know, I don't want to comment about what happened that night, but to me, it just looked like a bad night because my interaction with him was what I described in the book, and what happened even subsequent to what I described in the book after I got out. Uh, he's very probing in his questions, very analytical, very calm about things. When you go into brief him, Major, you better really know your topic because he's going to ask you very relevant questions. And he's very reflective on things and just doesn't jump out with conclusions or anything, but is very analytic. So my interactions with him, I have to say, have been very, very positive and in every way.
Did you see the debate?
I did.
Did anything about that, what you saw, medically alarm you?
I can't say. I think it would be inappropriate to say that, Major, because when you're just looking at someone on a one-shot basis, you just don't know what could happen. Did he have a bad cold? Did he take an antihistamine to make him, groggy or what have you? We don't know what went on. And I think it would be unfair and inappropriate to try and diagnose something from just a 90-minute clip.
Any doubt in your mind President Biden has the vigor and mental capability to carry on with this office?
In my interactions with him, I have no doubt. And I can only speak in my own interactions with him.
Jerome Adams, who you talk about in your book, served with Surgeon General during the Trump administration, was on this program, said much the same things that you've said just recently about COVID vaccinations and the efforts. But he also said, look, there are things that still rub me the wrong way. And he remembers, and many of those who are sympathetic to former President Trump remember comments of which I'm going to communicate to you. I'm going to read you a headline, September 5th from Politico 2020. Harris says she wouldn't trust Trump on any vaccine released before the election. Jerome Adams said there was a partisan aspect even before the vaccine became available in the heat of that 2020 campaign that wasn't helpful, that politicized this whole idea. Do you have any disagreement with that?
Yeah, I mean, I think any politicization of that is unfortunate, regardless of where the politicization comes from, Major. I've always felt that way. We've got to make sure we just stick with the science and make recommendations purely based on public health principles and scientific principles and not politicize any aspect of this.
You talk in the book with some frequency about former President Trump's relentless optimism and his desire that people around him in this crisis sound optimistic. Impediment or advantage?
Impediment, because it was unrealistic. I mean, that's the thing. In the very beginning, when we, as part of the team, the coronavirus task force, which was led by Deb Burks, when we went to him and said, we're having a tsunami of cases. So what we've got to do is we've got to really have physical distancing and have that 15-day flattening the curve and extend it to 30 days. He, to his credit, accepted that because he was hoping that, like influenza, and as I described in the memoir, Major, he kept on confusing a bit COVID and influenza. He wanted it desperately to act like influenza, which means it peaks in the winter months and then come March and April, it'll go away. So he kept on saying it's going to disappear like magic. And I kept on telling him, we have no evidence it's going to disappear like magic. But he was looking at the economy and he was looking at the election cycle and he wanted it to go away. And when it didn't go away like magic, he started to say things that were scientifically not true.
Any advice you have for those in your profession about how to balance mental health, the internal emotions, and the obligations of the work?
Well, yeah, I mean, as I've told so many of my friends and colleagues who ask, I'm not exactly the poster child for a normal work-life balance, as my family often reminds me. But my advice to people in the medical profession, but in any profession that has a high degree of stress and tension, you've really got to take care of yourself, because if you wear yourself down, and you may wind up having the paradoxical effect of not doing your job as well as you can,